Dr. Venincasa has been providing quality dental care in a professional manner since 1986. Although his expertise is in cosmetic, restorative, and single-visit restorative dentistry, he also provides general and family dentistry. Dr. Venincasa earned his doctorate in dental surgery from the University of Texas Health Science Center in San Antonio, Texas. Dr. Mark Venincasa is here with us to discuss preventive dentistry. Welcome, Doctor. My first question to you is, what is preventive dentistry?
Preventive dentistry, generally, it has to do with those things that can be done to prevent problems. Usually we think in terms of, patient procedures at home, like flossing, having fluoride in the water, having fluoride, of course, in the toothpaste. But prevention can also include things that patients eat. So during a meal, I'm not too particular about what our patients eat. But after a meal, if a patient doesn't have access to a toothbrush, I certainly don't carry a toothbrush around. So after a meal, I'll generally drink or swish some water. That helps to get food particles out. It helps to dilute sugars or acids so that you're minimizing problems that way. Prevention, in my mind, can also include, for those who have bruxism or who clench and grind, a night guard I would consider a preventive part of preventive dentistry. I would also say that going to the dentist regularly. Some patients need to go 3 to 4 months, other patients every 6 months, just so that the dentist can find things that might be starting to happen. It's so much less expensive to fix things when you find the problems earlier, as opposed to some patients just want to wait until things hurt. And to be honest with you, and there are cases where we have seen teeth that have basically rotted down below the gum line and the root of the tooth is still there, and you look down inside and it's just all rotted inside the root, and they never had pain, and that was their indication. They knew that things were falling apart, but they just didn't pursue any care. And so, in that case that I just mentioned, there's no fixing the tooth. It's just, they've totally lost the tooth. There's no options. If they had been more preventively oriented and were able to see it, the care could have been a lot less extensive and certainly a lot less expensive. So there's a lot of things that we can help patients with in preventive dentistry that really can save them thousands and thousands of dollars over their lifetime, and that can save them hours of time in the dental chair. I really have worn my teeth over time, but a lot of times they will absolutely deny that they grind. But like I said, we see what's on their teeth, and it's like that old saying, the proof's in the pudding. And we don't strong arm the patient into believing it. We just show them the pictures, and that's the proof right there. They'll say that they sleep with their mouth open, or that they have allergies, they can't breathe through their nose, so their mouth is open a lot, or they say that their spouse doesn't recognize any noise going on from clenching or grinding. But we explain to them and show them in the pictures what's going on. And sometimes it just takes a while for patients to understand that that's what they're doing. And a lot of times after we talk about it, they might come in for their next cleaning like 3 months or 6 months later, and they might admit, after we talked about this, I find that I do clench or grind when I'm driving, like at rush hour, or when I'm working on my computer, I clench and grind my teeth, or when they're doing something, maybe there's a habit, a hobby that they're working on, and they find that they just kind of clench or grind, and that's when they start to understand, okay, now I believe you, now I can understand that there is more going on than I thought. Let's go ahead and get the night guard, or let's go ahead and look at what we need to do to change the way my body works so that I can limit the damage that I'm doing in the teeth. And then in those cases also, in every case where there's this bruxism, we recommend this special guard so that we can protect the teeth from wearing down any further, at least while they're sleeping.
What does preventive dentistry do?
Preventive dentistry helps us to prevent problems. It helps us to have problems maybe start sooner or to progress slower. And preventive dentistry helps patients to help themselves, or preventive dentistry can help me to help the patients in the way of saving them money or saving them from having more extensive dental procedures done.
Who benefits from preventive dentistry?
The patient for sure. That's what we're all about. The patients benefit from preventive dentistry. So there's things I can do in the way of preventive dentistry, and there's things that the patient can do on their own in the way of preventive dentistry. And so working together, we can help the patient. And that's what we're here to help patients. Number one, try to prevent having any dental work done in the first place, because there's really nothing like the natural tooth. But if there's any defect or any problem in a natural tooth, it does need to be fixed. And it needs to be fixed in a way that conservatively fixes the problem so that we can prevent problems later on. So it's all about the patient. I understand patients want to save money, they want to save time, and there's things that patients might do to try to do things on their own or try to just think that maybe because they have no pain, that's in a way preventive dentistry. But I really recommend professional care. I know it's time and I know it's some money, but we really can save patients money and time if they allow us to help them. So, we indicated that there's things a patient does in the way of preventive dentistry, and there's things that I can do to help the patient in the way of preventive dentistry. So if we can work together, that's for the patient's benefit.
What are the benefits of preventive dentistry?
The benefits of preventive dentistry include helping to minimize the potential for pain, to minimize sensitivity, to minimize more major problems, to minimize problems that might be irreversible. For instance, there's damage that can occur to a tooth to where it can't be fixed anymore. Or there's problems that can exist within the gums or the jawbone that maybe cannot be fixed anymore. With preventive dentistry, we can find things sooner, we can start with more conservative treatment, and so we can prevent these times when we're losing options, when we're losing the ability to save things. We can save patients lots of money, we can save them lots of time. So I really can't stress enough the importance of preventive dentistry, not only on the patient's side and what the patient can do, but honestly, with a really good dentist, there's a lot of preventive things that a dentist can provide as well for the patients to benefit them greatly with preventive dentistry.
How often should I see my dentist?
I would say a patient should see their dentist as often as what the dentist would recommend, which for most patients is every 3 to 6 months. But if something happens, if something feels different in the patient's mouth, or if they're having some unusual sensitivity, if they notice something's changed, something's loose, something feels squishy, they feel a hole, they're trapping food that they never have trapped before, these are other times when I really feel like it would be best for the patient to see the dentist sooner as opposed to waiting for their regular preventive visit. Because again, if we can find things sooner, that can make it to where we have more options available for fixing the problem, or we can prevent the problem from getting significantly worse.
What questions should I ask my dentist about routine dental care?
I would say if you've got dental work done in your mouth, that might require extra care. If you've got gaps in your teeth, if there's anything that concerns you, I would ask your dentist if there's anything outside of normal brushing and flossing, anything outside of the normal procedures that we recommend. Do you need to do anything more to help prevent problems? For some dentists, that might open the door for them to let you know if there's, that makes the dentist realize that you're open perhaps to getting a night guard if there's signs of wear. There might be some other things that for one reason or another the dentist didn't want to open up. Maybe there's some signs of acid erosion on your teeth. There could be signs of acid reflux. And that might open the door for some dentists to say, there is this other thing going on. And, for whatever reason, they might have been uncomfortable mentioning it, or maybe uncertain that something was going on, but it would open the door for them to think maybe a little bit more outside the box and for your certain conditions and findings, and can honestly help you with maybe other things that should be considered to help prevent problems, since you're showing that interest.
What can I do to protect my teeth during sporting events?
During sporting events, a lot of times an athletic mouth guard would be recommended. Now, this is much different from the bruxism type guard that we recommend. But in contact sports like basketball, football, certainly karate, those kind of sports, skiing even, is recommended now to have a sports kind of a mouth guard to help in those occasions, maybe when there could be a fall and the teeth slam shut, or when there could be a blow to the teeth that can cause breakage or chipping. So you know what sports you're involved in, what can happen. If there's that potential for your head or your teeth to get in a situation where they're hit by something, or where you might get slammed shut for whatever reason, I really would consider getting a guard. And if you're not really sure, I would ask your dentist and tell them what activity you're doing, and ask them, do you think that I need to get an athletic mouth guard for these kind of activities?
Can you share a few simple tips for a healthy teeth?
Yes, I'd be glad to. So of course, most people know about the brushing and flossing. So I'm going to go into things that might be a little bit different. So in those cases, there could be clenching or grinding. If a dentist has kind of hinted to you or invited you to consider getting a guard, please get the guard. I see that saving so much in the way of problems, saving procedures, money, time. So if you do have that issue, if you find that you're clenching or grinding, please ask your dentist about getting a guard. Another thing, patients might do things like, of course, after a meal, most patients know it would be good to brush afterwards. I don't carry around a toothbrush, so I'll usually drink or rinse with water after a meal. But a lot of times patients might not consider what they're doing between meals. A lot of patients might drink coffee for several hours a day. Some patients drink sports drinks or the energy drinks, tea, sodas. So many things have acids or sugars in them, and you really should consider those, because if you don't, when you think about it, for hours a day, 5 times a week or 7 times a week, you're just bathing your teeth in acids and sugars, and that very much can have a detrimental effect on the teeth. And so I don't dissuade people from enjoying what they want to enjoy, but I do ask our patients to drink them or eat them in a responsible period of time. And then afterwards to rinse or drink some water to get the food particles out, to get the acids and sugars out. And I know it sounds boring, but to sip on water for hours of time instead of on those other things that very often have sugars or acids in them. As far as anything else, if there's some odd habits you might do, like biting into things that are particularly hard, and you notice that they might cause grooves or chipping in your teeth, it might be sewing needles or nails, or you can think about those things. Anything that you think that can be damaged into the teeth, of course you want to avoid that. Outside of those things, I think you really pretty much would have everything handled.